Hi, it's Dr. Matt Russell from Vizon. In this video, I'll answer the common question, what are the advantages and disadvantages of PRK? The biggest advantage of PRK or surface laser is that we can do the treatment safely on corneas that are much thinner than average. And this is a very safe option for patients who are really not candidates for LASIK. Just to clarify, the cornea is the transparent window on the front of the eye, and it's the part of the eye that we apply laser to change your vision. There's only so much cornea that we can treat, and the amount of treatment we need to do is always higher with LASIK. And it's always higher in patients who have a higher prescription in glasses or contact lenses. In LASIK, we create a flap, but this counts towards the amount of cornea that we're treating. Some people's corneas are thinner than others. Because of this, some people are just not good candidates for LASIK surgery, but many of these patients are great candidates for PRK or surface laser. That enables people who can't safely have LASIK to get the many benefits of laser eye surgery. There are other advantages in special groups of patients. For example, I might recommend PRK for patients who may be vulnerable to an eye injury because of their occupation, such as a police officer or someone who works in the Defense Force. In that instance, that person would be at no greater risk of being incapacitated because of having a history of laser. So PRK would not place them at any greater risk of being rendered incapable of performing their job or making themselves or their health vulnerable because of previous laser surgery. Another big advantage of PRK is that it's a much easier procedure to go through as a patient on the day of treatment. With no-touch transepithelial PRK, effectively you just need to look towards the laser aiming beam for between 30 and 45 seconds. The laser will track any of your small eye movements perfectly, and there is an eyelid support, so the blinking is not an issue. We have the leading technology for transepithelial PRK with the Schwindemacher's 1050RS Excimer platform from Germany, which is regarded as setting the standard for transepithelial PRK treatments. LASIK, on the other hand, involves a suction device used to immobilize the eye while the LASIK flap is being created. For some people, the thought of this is just too much to bear, and trans PRK is an excellent alternative in this situation. The disadvantage of PRK is that it can be an uncomfortable or painful procedure to recover from compared to LASIK. It takes 2 or 3 days to recover from the discomfort of the operation instead of just a few hours following LASIK. And the perfect vision that you can expect in the long term takes longer to achieve than LASIK. Again, the recovery of vision following LASIK is overnight. After PRK, most patients recover reasonable vision within 3 to 4 days after the procedure, but they don't have their best vision for often 4 weeks or more. To complete the picture, another advantage of PRK is it tends to be less expensive than LASIK, and that's also true at Vizon. At the time of this video, for as little as $99 per month, you can experience the life-changing results of being glasses-free and contact lens-free. If you'd like to see if you're a suitable candidate for LASIK or any other vision treatment that we offer, take our online self-test today. This 2-minute self-test will take you through a series of questions that will provide you with an early indication as to whether or not you're a suitable candidate for treatment.